Top 30 dentist interview questions and answers. Preparing for a dentist interview requires more than technical expertise. It demands strong communication skills, professionalism, and a patient-centered approach. Employers seek dentists who can balance clinical precision with empathy, teamwork, and ethical practice. In this guide, we cover the top 30 dentist interview questions with well-structured answers to help you stand out. These responses highlight not only dental knowledge, but also leadership, problem-solving, and interpersonal skills necessary for success in today's competitive dental field. 1. Why did you choose dentistry as a career? I chose dentistry because it combines science, artistry, and service. The field allows me to make a direct impact on people's health, confidence, and quality of life. I was drawn to the precision involved in dental procedures and the opportunity to build long-term relationships with patients. Dentistry also offers continuous learning, enabling me to stay updated with new technologies and treatments, which fuels my passion for professional growth and lifelong learning. 2. How do you handle nervous or anxious patients? I start by creating a calm environment and practicing active listening. I explain procedures in simple terms, answer questions, and use reassurance techniques to build trust. For particularly anxious patients, I employ relaxation strategies, such as deep breathing and distraction. I also give them control, like signaling if they need a break. My goal is to ensure comfort, reduce fear, and build a positive experience that encourages patients to return confidently. 3. How do you stay updated with the latest dental advancements? I actively participate in continuing education programs, workshops, and conferences to learn new techniques and technology. I subscribe to leading dental journals and follow professional organizations for research updates. Networking with colleagues also helps exchange practical knowledge. Additionally, I incorporate digital tools, such as online courses and webinars, into my learning routine. By staying informed, I ensure my patients benefit from modern, evidence-based treatments that improve outcomes and overall oral health. 4. How do you manage a busy dental schedule? I prioritize efficiency without compromising patient care. I coordinate with my dental assistants and front desk staff to streamline scheduling and minimize delays. Time management, clear communication, and preparation before each appointment are crucial. I also maintain flexibility for emergencies while ensuring routine checkups run smoothly. By staying organized and fostering teamwork, I keep the workflow steady, reduce stress for patients, and maximize productivity while delivering high-quality dental care consistently. 5. How would you handle a difficult patient? I remain calm, respectful, and empathetic, regardless of the patient's behavior. I listen carefully to understand their concerns, validate their feelings, and provide clear explanations to reduce misunderstandings. If emotions escalate, I de-escalate through patience and professionalism. I set boundaries politely and focus on solutions. My aim is to ensure their dental needs are met while maintaining a positive relationship. Compassion and professionalism often turn challenging encounters into opportunities for trust building. 6. What do you find most rewarding about being a dentist? The most rewarding aspect is improving patients' quality of life. Seeing someone smile confidently after treatment or relieving them from pain is incredibly fulfilling. I also enjoy the opportunity to educate patients about oral health, empowering them to maintain long-term wellness. Dentistry blends science with artistry, allowing me to make tangible differences daily. Building trust and long-term relationships with patients also brings personal and professional satisfaction that motivates me continually. 7. How do you explain complex dental procedures to patients? I use simple, non-technical language and visual aids such as models, diagrams, or digital images to explain procedures. I break down each step, highlight expected outcomes, and discuss potential risks. I encourage patients to ask questions and ensure they feel fully informed before proceeding. Transparency and patience help reduce anxiety and foster trust. This approach empowers patients to make confident decisions about their treatment, strengthening the dentist-patient relationship significantly. 8. How do you manage dental emergencies? I prioritize emergencies immediately, ensuring the patient receives prompt attention. I assess the situation thoroughly, provide temporary relief if necessary, and create a treatment plan tailored to the condition. Clear communication with the patient about the urgency, procedures, and aftercare is essential. I also coordinate with my team to accommodate emergencies, while significantly disrupting the schedule. Quick, decisive, and compassionate action ensures patients receive timely care while minimizing complications. 9. How do you handle patient confidentiality? I strictly follow HIPAA and other privacy regulations, ensuring patient records are secure and accessible only to authorized personnel. I maintain confidentiality during conversations by being mindful of the environment and never sharing sensitive information unnecessarily. I also educate my staff about confidentiality protocols. Respecting privacy builds trust and professionalism, which is critical in dentistry. Patients must feel assured that their personal and medical information is protected at all times. 10. How do you educate patients on preventive care? I emphasize the importance of daily oral hygiene practices, such as brushing, flossing, and regular checkups. I explain how diet and lifestyle choices affect oral health, using easy-to-understand examples. I provide personalized guidance based on their condition, sometimes using visual aids to make learning engaging. Preventive care education empowers patients to take ownership of their oral health, reducing future complications. I believe consistent education is key to long-term wellness and trust. 11. How do you handle disagreements with colleagues or staff? I address disagreements calmly and respectfully, focusing on finding solutions rather than assigning blame. I listen to their perspectives, clarify misunderstandings, and communicate openly to resolve conflicts. If necessary, I involve a supervisor or use team meetings to discuss and implement improvements. Mutual respect and professionalism are essential in maintaining a positive work environment. By handling disagreements constructively, I strengthen teamwork, enhance collaboration, and ensure patient care remains a top priority. 12. What do you enjoy most about working with children? I enjoy their energy, curiosity, and openness to learning. Working with children requires creativity and patience, which makes dentistry fun and rewarding. I use child-friendly explanations, playful distractions, and positive reinforcement to create a stress-free experience. Helping children develop good oral hygiene habits early sets the foundation for lifelong health. Seeing their confidence grow after a successful appointment is fulfilling and strengthens trust with both young patients and their families. 13. How do you deal with patients who refuse recommended treatment? I respect patients' decisions while ensuring they're fully informed. I carefully explain the importance of the treatment, potential risks of refusal, and alternative options. I listen to their concerns, whether financial, emotional, or fear-based, and address them empathetically. I document discussions and provide educational resources for later consideration. Ultimately, I aim to empower patients with knowledge while respecting autonomy, fostering trust, and encouraging them to make informed decisions about their health. 14. How do you maintain infection control in your practice? I strictly adhere to standard infection control protocols, including sterilizing instruments, using disposable items where appropriate, and maintaining a clean environment. Personal protective equipment, PPE, such as gloves, masks, and gowns is mandatory for every procedure. I also ensure my staff undergo regular training and follow best practices consistently. Patient safety is a top priority, and strict infection control measures safeguard both patients and staff, reflecting professionalism and high-quality care. 15. How do you motivate your dental team? I foster open communication, encourage collaboration, and recognize individual contributions. I create an environment where staff feel valued and supported, offering constructive feedback and professional development opportunities. By setting clear goals and celebrating successes, I boost morale and teamwork. I also encourage problem-solving and input from all team members, ensuring they feel included in decision-making. A motivated team delivers better patient care and enhances the overall efficiency of the practice. 16. How do you ensure accurate dental records? I maintain detailed, clear, and timely documentation of all patient interactions, diagnoses, and treatments. I use digital record systems for accuracy, ensuring information is secure yet accessible to authorized personnel. Consistency in updating records after each visit prevents errors and facilitates continuity of care. I also train staff to follow the same standards. Accurate records are essential for legal compliance, patient safety, and delivering effective, personalized treatment plans over time. 17. How do you approach pain management for patients? I assess the patient's pain level and medical history before recommending appropriate solutions. Options may include local anesthesia, sedation, or pain relief medication, depending on the procedure. I also use gentle techniques and explain steps to reduce anxiety. Post-procedure, I provide clear aftercare instructions to minimize discomfort. By combining clinical expertise with empathy, I ensure patients feel as comfortable as possible, which builds trust and encourages compliance with treatment plans. 18. How do you deal with time-sensitive dental surgeries? I plan thoroughly, ensuring all instruments, materials, and staff are prepared in advance. I remain focused, efficient, and adaptable during the surgery to handle unexpected challenges. Communication with my team is essential to maintain precision under pressure. I prioritize patient safety while balancing speed and accuracy. After the procedure, I provide clear post-operative instructions. This structured approach ensures successful outcomes while managing the urgency and stress of time-sensitive surgeries effectively. 19. What do you consider your biggest strength as a dentist? My biggest strength is my ability to combine technical precision with compassion. I am detail-oriented and committed to delivering high-quality dental care, while also focusing on patient comfort and trust. I adapt my communication style to suit each patient's needs, ensuring they feel informed and valued. Additionally, my continuous pursuit of learning and teamwork allows me to grow professionally while contributing positively to the practice and enhancing overall patient experiences. 20. What do you consider your biggest weakness? I sometimes focus too much on perfection, which can slow me down during certain procedures. However, I've learned to balance efficiency with accuracy by trusting my training and experience. I set realistic expectations while maintaining high standards. I also use time management strategies and seek feedback from colleagues to improve continuously. This self-awareness helps me grow, ensuring I provide excellent care while remaining mindful of time and patient needs. 21. How do you build trust with your patients? I build trust by listening actively, showing empathy, and providing clear, honest communication. I ensure patients understand their treatment options and involve them in decision-making. Being transparent about risks and outcomes reassures them of my integrity. I also respect their time by maintaining punctuality and professionalism. Small gestures, such as following up after major procedures, demonstrate care beyond the clinic. Consistency in these practices strengthens long-term relationships and patient loyalty. 22. How do you handle stress in dentistry? I manage stress through preparation, organization, and maintaining a positive mindset. Time management helps me stay efficient, while teamwork reduces pressure. I also practice mindfulness techniques, such as deep breathing, during demanding situations. Outside of work, I prioritize exercise and healthy routines to maintain balance. By staying calm and focused under pressure, I ensure patient care remains uncompromised and foster a professional environment where challenges are managed constructively. 23. How would you handle a situation where a treatment goes wrong? I would remain calm, take responsibility, and address the issue immediately. First, I would explain the situation honestly to the patient, ensuring they understand what went wrong and the corrective measures planned. I would prioritize patient safety and provide the necessary treatment at no extra cost. I would also reflect on the incident to identify improvements. Transparency, accountability, and corrective action are essential for maintaining trust and preventing future errors. 24. How do you ensure patient comfort during procedures? I begin by explaining the process clearly to reduce anxiety. I check in regularly during the procedure and offer breaks if needed. Gentle techniques, local anesthesia, and distraction strategies help minimize discomfort. I also create a welcoming environment with supportive staff and soothing surroundings. After treatment, I provide aftercare instructions to ensure continued comfort. My patient-centered approach helps reduce fear and makes dental visits more positive and reassuring experiences. 25. How do you manage pediatric patients who resist treatment? I use patience, empathy, and creativity to engage children. I explain procedures in a playful and age-appropriate way, sometimes using toys or stories. Positive reinforcement, like praise or small rewards, encourages cooperation. If fear persists, I reassure both the child and parents while using gentle techniques. Establishing trust and making the experience less intimidating helps children gradually overcome resistance and build confidence in visiting the dentist regularly without anxiety. 26. What role does technology play in modern dentistry? Technology enhances diagnosis, treatment precision, and patient education. Digital X-rays, intraoral cameras, and CAD/CM systems allow for accurate imaging and efficient restorative procedures. Laser dentistry improves comfort and recovery times, while digital records streamline patient care. Technology also supports patient engagement by visually explaining conditions and treatment options. By integrating advanced tools, dentists can deliver safer, faster, and more effective care, ultimately improving patient satisfaction and overall clinical outcomes significantly. 27. How do you balance clinical and business responsibilities in dentistry? I prioritize patient care while recognizing that a dental practice also requires effective management. I delegate administrative tasks to trained staff while maintaining oversight of finances, compliance, and workflow. Regular meetings help align business goals with clinical objectives. I also use digital management systems for efficiency. Balancing both aspects ensures the practice runs smoothly, patients receive excellent care, and the business remains sustainable for long-term professional growth and success. 28. How do you approach ethical dilemmas in dentistry? I approach ethical dilemmas by prioritizing patient welfare and following professional guidelines. I evaluate situations objectively, considering both ethical principles and legal requirements. Open communication with the patient ensures transparency, while consultation with colleagues or professional bodies helps in complex cases. Integrity and honesty guide my decisions, even if it means financial sacrifice. Maintaining ethical standards builds trust and reflects a commitment to professionalism and quality patient care. 29. How do you ensure effective communication with non-English speaking patients? I use interpreters or bilingual staff when available, and I rely on visual aids, diagrams, or translation apps to bridge communication gaps. I speak slowly and clearly, avoiding complex terms, to enhance understanding. Patience and empathy are key to ensuring patients feel respected and understood. Clear communication ensures accurate diagnosis and treatment, strengthens trust, and makes dental care accessible to patients of diverse cultural and linguistic backgrounds. 30. Where do you see yourself in 5 years? In 5 years, I see myself as an established dentist with expanded expertise in specialized areas such as cosmetic or implant dentistry. I aim to continue developing professionally through advanced training while mentoring younger professionals. I envision contributing to community health initiatives, promoting preventive care, and strengthening long-term patient relationships. Ultimately, I want to balance clinical excellence with leadership, making a positive impact on both my patients and the dental profession. Dentist interviews evaluate not only your technical expertise, but also your interpersonal skills, ethical judgment, and ability to manage real-world challenges. By preparing thoughtful responses to these common questions, you can demonstrate competence, confidence, and compassion, qualities employers value highly. Focus on patient-centered care, teamwork, and continuous improvement to stand out. With strong preparation, you'll be ready to showcase your skills and secure success in your dental career.